for the background?
Be able to block these.
Oh, good God. What's it is a complete waste of time.
That just makes me look really short, thank you.
No, you honestly step out.
I'm just going to get I'll get my chest in
There
this
is,
shot.
there is of no point
I
having...
know. I have to go like this.
Hey, how are you? Thanks for having us. Audio level, testing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. David Crisafulli, Leader of the Opposition, with Ros and David and Trevor, who's too tall to be in the background. Well, good morning everybody, and welcome to the LNP's 28th Queensland Health Crisis Town Hall meetings. A great opportunity for us to do two things. One is to have wins for individuals, and today you will hear stories from brave Queenslanders, people in the Darling Downs who are caught up in the health system. They might be waiting for an appointment, they may have had a traumatic incident, and they come here and they bravely tell their stories. And by doing so, we've been able to help Queenslanders right across the state, and that's very, very fulfilling. It also is our way of putting forward solutions to heal the Queensland health crisis, and we are determined to do that. We would love the government to adopt those solutions, and we'll continue to push those forward. That's what good, effective opposition is, and by doing these town hall meetings, we've been able to put forward things like better resources, sharing data in real time, improving triaging, but above all putting local doctors and nurses back in charge. And that is the aim of the game. We want to change the culture in Queensland Health to put the power back in the hands of the frontline staff. That is the way to heal the Queensland health crisis. And it's never been needed more than now. In the Darling Downs at the moment, for the first time in history, 40% of people who turn up are ramped at the end of that ambulance ramp. 40%. That is uncharted territory in the Queensland health crisis on the Darling Downs. Don't blame the frontline staff. Don't blame the AMBOs. It's been 7.5 years of poor planning. And every AMBO we speak with knows that when they are parked at the end of the ramp, at the other end of the phone is somebody waiting for assistance in their hour of need with an AMBO that doesn't turn up. We're going to keep putting our solutions. We're going to keep doing these town halls. We know the government doesn't like them. We know they're uncomfortable about them, but we are determined to get a world-class health system no matter where people live. I'll ask our Shadow Health spokesperson, Ros Bates, to say some words.
Thanks, David. Ros Bates, Shadow Minister for Health and Ambulance Services and a registered nurse. Well, as David just mentioned, we are in uncharted waters here in the Darling Downs. To have ambulance ramping in this area at 40% has never been seen before. We know that 40% of patients are not seen within the clinically recommended time frame. We also know that it's 2 out of 5 patients who are waiting on a ramp when a paramedic should be out off that ramp and picking up your loved ones in their hour of need. We know that the ambulance has lost thousands of hours on the ramp over the last 12 months here in Toowoomba. In fact, it was one whole shift a day of paramedics that were ramped at Toowoomba Base Hospital. Now, this is not good enough. The government does not have a plan. They have made announcements about billions of dollars into the future. They've had 7 years and 3 terms to solve issues out here in the Darling Downs, and they're asking you for another 7 years. You cannot trust the Palaszczuk Labor government with health, and you certainly can't trust Yvette D'Arth, the embattled health minister. David.
Thank you, Ros, and David Janetzki, Shadow Treasurer but local MP here in Toowoomba South. And I just want to thank DC and Ros for being here today, because it's a really important and a really timely visit that we have the 28th Town Hall here in Toowoomba. I just want to spend a couple of moments on our new Toowoomba Hospital, because it is something that our community desperately needs. For so long, we have been waiting for our new Toowoomba Hospital. And it's now time for it to be delivered. We've waited 7 years under this government, and now they're asking for another 7 years to fix it. Only 1% of state hospital funding of what it was announced in the budget will be spent this financial year. That's not good enough for a community like ours that has been waiting a very long time for our hospital. In fact, the government has spent over $1 million in the last 5 months on advertising the hospital plan, but we don't need advertising. We need construction, we need building, we need a plan. For our community that has been waiting such a very long time, we need our new Toowoomba Hospital. It'll be a centre of excellence. It will be a place at the west to the west to the Territory border and south to the New South Wales border, they will be looking to our hospital to help them in their hour of need. There's no time for advertising. There is now time for it to be constructed. And we can't just have 1% of state government funding in the next financial year. We need a plan, we need key performance indicators, and we need milestones as to when our hospital will be delivered. I also want to pass comment on the Premier and the Treasurer and the Health Minister. 4 months before the federal election used to talk about 50-50 health funding. Well, there's crickets on that now. They don't talk about 50-50 health funding anymore, and that is vitally important for the future of our health system. We need a government that we can trust, a government that will deliver the health services our community needs, not a government that plays politics and advertises. We need a government to deliver, and our project here at the Toowoomba Hospital is vitally important to healthcare across our region. And I'm looking forward to speaking today with the people here. There will be federal issues, there's state issues, but everybody wants to see a better health system for the patients, for the people that work in our health system, who do an extraordinary job across our region. We deserve a world-class health system here, and we haven't been getting it. And right now I'm concerned that over the longer term we're getting advertising and promises and not delivery. I'm going to hand over to Trevor Watts, local MP as well.
Thank you, guys. Trevor Watts, member for Toowoomba North. And look, I'd like to thank the Leader of the Opposition, Dave Crisafulli, and our Shadow Health Minister, Ros Bates, for coming to Toowoomba. We've been asking for this forum, and it's great to see the local community response. Basically, what I want to say is that you can't trust this Labor government with our health system here in Toowoomba. They've been talking now for 7 years and 3 terms of government about a hospital. It's been designed, it's been planned, and they deliver 1% of funding to start the hospital. That is a sad joke on the people of Toowoomba, because it will not deliver the beds we need. And we know that when this hospital is finished, it will fit the needs of 7 to 10 years ago, not the needs of 10 and 15 years in the future. So I'm calling on the Labor government to listen to the people of Toowoomba, deliver the proper funding, get on with the construction, because our frontline staff are desperately struggling in a hospital that is covered in band-aids just trying to get through to the next morning. And so I really appreciate the health forum here, and I'm sure we will hear some stories of people who are getting great service from the frontline staff, but they're having to wait a long time, or they're being shifted down to Brisbane, or the capacity of this hospital cannot cope with the needs of the people of Toowoomba and the Darling Downs. Thank you.
Thank you, Watsy, and thanks for your work. Thank you. Over to you.
Just a question on satellite hospitals. What are your thoughts on the satellite hospitals?
We've been really upfront about that. Unfortunately, the government hasn't. And we said at the time that they need to be called what they are. And to hear secret recordings show that the government deliberately avoided advice on not calling them hospitals is deeply troubling. We want to see Queenslanders to have a government they can trust, and the fact that the Minister would deliberately seek to change the name against the recommendation from the independent professional staff shows you everything you need to know. This government is more interested in its political survival than patient survival, and there is a real risk with calling something a hospital when it is in fact not. And we just want openness and transparency when it comes to that. Ros, did you want to say something on that?
Well, let's be very clear. These satellite hospitals are not hospitals. They are multi-purpose health centres. There is no overnight beds. There is no emergency department. There is no theatre. There's no intensive care unit. The danger in calling them hospitals is that locals will turn up, and I'll give you a couple of examples. You arrive there with your child having an asthma attack. That child needs to be admitted and needs further treatment. You cannot do that at a satellite hospital. Your father turns up there with a heart attack, cannot be treated at that hospital. You would waste valuable, critical time in a trauma waiting to call an ambulance to transport those patients to a real hospital. All that will do will re-traumatise patients and their loved ones in their hour of need.
Thanks, Ros. Thanks.
A question about the outcomes from the stories that you've heard. You said you've been able to intervene in a meaningful way.
Yeah.
What are the examples of them?
Thanks for the question. We've had many, but the one that sticks in my mind was a man in the far north who on 5 occasions had had his surgery cancelled, once on the morning of his surgery being wheeled in, having fasted all night, and the hospital went into a code yellow. That person wasn't given the next date for that appointment. Through Roz's advocacy, we were able to get him an appointment. He had his life-changing surgery the next week. That is personally very, very satisfying. And when people hear the term elective surgery, it's easy to think, well, that mustn't be that important. These are life-changing surgeries. They're a hip replacement, which means that you can get out of bed. They're a colonoscopy, which could stop you dying from cancer. They're a cataract operation so that you can see the world again. These are life-changing. And for us to be able to allow people the platform and give them a voice and listen to them and take up their case, that is really meaningful. We're also trying to fix the system for the millions of Queenslanders who rely on it and deserve it. And they're the two elements of these, and we're going to keep doing them.
From what you've heard so far, 28 ballrooms, what would you do right now?
It starts with better resources, and I think Trevor articulated that well, and we do need to properly resource the front line. And that costs money, and that's why, as David said, that 50-50 partnership is so important. But there are things that we could do immediately that don't cost a lot of money. Sharing data in real time, improving our triaging, and putting doctors and nurses back in charge. They are things that could happen immediately. And we know that the government has information, like the data in the emergency waiting times, because Ros was able to get that information during estimates where the ambulance commissioner says that he has that on his desk. So we want that data shared. We want accountability. We want the minister to be held accountable, and we want to drive that cultural change. Those things can happen and can happen now. And we're determined to do that. And the next election's, thank you, the next election is still a couple of years away, and we would like to think that Queenslanders shouldn't have to wait that long for these common sense solutions to be picked up straight away. If the government doesn't adopt them, you can assure you that'll be the first item of business if government changes in 2024.
Would you like to see the government turn up to one of these town halls and act in a bipartisan way?
The minister would be welcome, and so too would local members as we've done these. And we've had these across Queensland. We've had them in big centres, we've had them in small country towns. So our last one was in Dalby, and to hear the passion of people talk about how much they value those frontline clinicians in their community. They're their neighbours, they're their friends, they're their sporting colleagues, and they hold the health professionals in such high regard. What they don't hold in high regard is the administration of Queensland Health from the minister that hasn't allowed those people to be able to take charge of their communities in the front line. And that's the culture that we want to change.
You've got that real-time data and you want to streamline triage. What would be the first action? How does it streamline the system?
Well, Ros has worked as a hospital administrator before, and there are ways by use of things like clinical initiative nurses where you can improve that, and we've been listening and putting those solutions forward. But I commit that will be the cultural change that occurs immediately if government changes. And I've committed to a few things that the government doesn't have. One is a Minister for Open Data, 2 is a Minister for Customer Service, and 3 is a Minister for Integrity. Now, none of those positions exist at the moment, and I would argue that tells you everything you need to know about a government in its third term that no longer listens and is no longer open and transparent. We are prepared to put out information in real time because it drives accountability and it also allows that change to occur. And sure, at times that means that we might cop a bit of a kick in the backside for things that mightn't be going as well as it should. That's okay. Through that, you drive change. Through that, Queenslanders get a better service. That's the cultural change we want to oversee.
I know the event's yet to start, but have you heard any horror stories yet from locals down?
We are looking forward to listen, and today you will have people who have been caught up in the health system. You'll have people who work in the health system, and that's one of the most satisfying things, is that people who work in health are prepared to come forward and share their stories and share their solutions. That's what's made this concept so very, very powerful. And right now in the Darling Downs, you've never needed that more than ever. You have ambulance ramping at uncharted territory, and you have a new hospital that the government is asking Queenslanders after 3 terms for another 3 terms before they deliver it. Both of those things need to change, and they need to change immediately. All good? Thanks very much.